Hi Sam. So today we're going to assess the musculoskeletal system and we're also going to check your strength. So we would normally start with your temporomandibular joint, but we did that in week 3, so we're not going to do that today. But we are going to move down to your neck. So I'm just going to press here in the back of your neck. Do you feel any pain or tenderness when I press there?
Mm-mm.
Okay. Now could you take your chin and your chin and flex it to your chest for me?
Mm-hmm.
And now put your head straight and then all the way back. And now can you put your head straight and put your ear to your shoulder for me? And then the other side. And can you rotate your head side to side, your neck? Perfect. Now I'm going to place my hand here. Can you press against it? Okay. And now here. And how about this side? Okay, great. So I would say that you have full range of motion and +5 strength. Now Sam, with you standing sideways, I'm just going to take a look at your back. So what I see is right here, you're concave, and then you go down to convex, and then you're concave again. Do you have any tenderness when I press your back at all?
No.
Okay. So now I'm going to look at your shoulders to make sure that they're equal, and then I'm going to come down and check your hips to make sure that those are equal, and those look great. If you could you just bend forward and touch your toes if you can?
Sure.
So I just want to make sure that your spine is nice and straight, which it is. And now if you could just stand back up for me, or hyperextend backwards. And now just stand up straight, which would be extension. And now if you put your hands by your side, can you bend laterally, side to side? Perfect. And the other side. And now can you rotate side to side? Perfect. Next I'm going to check your shoulders. Is there any tenderness at all when I press?
Mm-mm.
Okay, and I would do that bilaterally. Now I'm going to ask you if you could lift your arm all the way up. So that's flexion, and then down. And that would be extension. Can you move it all the way to the back? That's hyperextension. Now, if you could lift your arm to the side, out to the side,
Sorry.
oops, that's abduction, and then across your body, and that adduction. Now, if you could put your hand right by the small of your back, so that's internal rotation, and then up by your head, and that would be external rotation. Now to check the strength of your shoulders, I'm just going to ask you to push up against my hands. So if you could push up. Great. So that's +5 strength. So you have full range of motion and +5 strength. Now we're going to move on to your elbow. So I'm just going to take a look at it. Any tenderness at all?
Mm-mm.
Okay. And I don't notice any swelling. So it looks good. So now I'm going to check the range of motion. So if you could just bend your elbow up for me.
Sure.
And now back down. So that's flexion and extension. And if you could just put your hand out for me. And then that's supination, and then turn it over. So that's pronation. So you have full range of motion of your elbows. Now we're going to check the strength. If you could turn it this way. If you could press down on my hand. Okay. And now up on my hand. Perfect. So you have full range of motion of your elbow and +5 strength. And I would do that bilaterally. Next I'm going to move on to your wrist, Sam. So I'm just going to palpate it. I notice that it's not swollen. There's no bogginess to it. Now is there any tenderness when I press?
Not on this wrist, but I do feel tenderness usually on this wrist.
Okay. All right. So if you could take this wrist, if you could bend it down for me, okay, and put it straight, and now bend it up. So that was flexion, extension, and then hyperextension. So now if you could move your hand towards your thumb, when you put it straight, and that's called radial deviation, and now the other way, and that's called ulnar deviation. So now let's check the strength of your wrist. So if you could just flex it, and I want you to push it up against my hand. Perfect. So you have on your left wrist full range of motion and +5 strength. And I won't check your right wrist because I know it's tender. Now let's check your fingers. So I'm going to palpate each of the joints of your fingers. Let me know if there's any tenderness. I don't notice any swelling or any nodules. No deformities in your hand. So to check the range of motion, can you make a fist for me? And this would be flexion. And then open them up. And this would be extension. Can you spread your fingers out? This would be abduction. Now can you take your thumb and bring it across to your little finger? And that would be flexion of your thumb. Now we'll check the strength of your fingers. So I'm going to ask you to squeeze my 2 fingers nice and tight. So that's +5 strength. And then to check the strength of your thumb, can you make the OK sign? And don't let me pull the thumb off. Perfect. So I would say you have good strength in your thumb. and you have full range of motion of your fingers. Okay, Sam, now I'm going to check your hip. So when I press here, do you have any tenderness at all when I press?
No.
Okay, so I want you to take your leg and can you bring it all the way up? And now could you bring your knee to your chest? And that would be flexion of the knee and the hip. Now can you bring your leg out? Now out to the side, perfect. That would be abduction of your hip, and now to the other side, and that would be adduction of your hip. Now can you bend your knee and bring it out this way? Okay, and that would be external rotation, and can you bring it the other way? Over this, perfect, and that's internal rotation. So that's full range of motion of your hip. Now I'm going to check the strength. So when I pressed my hand here, can you press it? You're perfect. And now I'm going to go underneath your thigh. Can you press down? Great. And now can you press in? And now out. Perfect. So I would say you have full range of motion of your hip and +5 strength. So moving down, Sam, I'm going to palpate your knee. Any tenderness
No.
in your knee at all? Okay, and then I'd move all the way down. I'm going to check your ankle. I'm going to make sure there's no swelling of the knee or the ankle, bogginess, no deformities. I'm going to check your toes. When I press on your toes? Okay. So now if you could do me a favor, I'm going to ask you to point your toes, to move your toes up toward your head, and that's called dorsiflexion, and then down, and that's plantar flexion. Now can you bend your heel inward and then outward? So that's eversion and inversion. Okay, and I'm going to have you press against my hands. I would do both bilaterally. So great, so you have +5 strength and full range of motion. Okay, Sam, so now I'm going to check the strength of your knee. So with you sitting, could you just press up against my hand? Okay, and now I'm going to go back, and could you just press back against my hand? Perfect. So I would say you have +5 strength of your knee, and I would do that bilaterally. Okay, Sam, so now I'm going to do a couple of tests to check for carpal tunnel syndrome. So the first one is called the Phelan's test. So if you could you put your hands together like this? Any numbness or tingling when you do that?
A little bit as I hold it longer.
Okay. So what we would normally do is have you do that for about 60 seconds, but seeing that it's bothering you, that's good. So now the other test I'm going to do is called the Tinel sign. So if you could hold your hands like this. So what I'm going to do is I'm just going to tap on your wrist.
Sorry, a little tingling, yeah.
Okay. So I would say that you have positive Tinel's and a positive Phelan's test. So, and that would be indicative of maybe carpal tunnel syndrome. Okay, Sam, so now we're going to move on to the neuro system, and that's something I started as soon as I met you, asking you questions, making sure you were alert and oriented. There's also a tool that you can use called the Mini Mental Status Tool that would assess mental status. Great. So the first nerve we're going to check is your first cranial nerve, and that's the olfactory nerve. We were supposed to check it week 3, I think, but I forgot, so we're going to check it now. So if you could just block one of your sides of your nose and sniff. Okay, so now what I'm going to do is I'm going to have you close your eyes, and I'm going to have you sniff this and tell me what scent you smell, okay? Can you sniff that?
Peppermint.
Perfect, and I would do that bilaterally. Next thing we would check is cranial nerve number 2, which is the optic nerve, but we checked cranial nerve number 2 and number 3 on week 3 in our video, so we're not going to check those today. Now we're going to check cranial nerve number 5, which is your trigeminal nerve. And I'm going to check the strength. So I'm going to press on your temporal area. And could you clench your teeth for me, Sam? Okay. And then I'm going to check your masseter muscles to make sure they're intact. Oh, perfect. So I would say that both your temporal muscles and your masseter muscles are +5 in strength. So next I'm going to use this paper clip, and I'm just going to check for your sensation. So I'm just going to press, so this would be sharp, and this would be dull. So I'm going to have you close your eyes. Can you feel the difference? Mm-hmm. And when I press, I want you to tell me which is sharp and which is dull. Okay?
Sharp. Sharp. Dull. Sharp. 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 Dull.
Perfect. So next we would check cranial nerve number 7, which is your facial nerve, to check for facial symmetry, but we've already checked that in week 3. And then also cranial nerve number 8, which is the acoustics, and we've already checked that in week 3. So now I'm going to check number 9. So what I'm going to do is I want you to, I'm going to shine a light, and I would just like you to stick your tongue out and say, ah.
Ah.
And when you do that, I notice that you have symmetrical rise of your soft palate. So that would check 9 and 10. The other thing I could do is take a tongue depressor, and if I touch your soft palate, I should be able to hear you gag. So that's cranial nerve 9 and 10. And then we also checked cranial nerve number 11, which is the spinal accessory nerve, when I had you push up on my shoulders, and number 12 when you stuck out your tongue, that it was midline. Okay, Sam, so now I'm going to check your gross motor strength. So if you could just walk heel to toe towards me. Perfect. So you're upright, you have appropriate movements, you're coordinated and steady. So can you bend your knees for me? Okay, and stand up. Can you stand on one foot? Good. And now the other? Perfect. Now can you hold your hands straight out in front of you, palms up, and close your eyes? And I'm going to look for any kind of drifting or pronation, and there is none. Your hand stayed steady, so that would be a negative palm or drift. Next, can you put your hands by your side? Now we're going to do the Romberg test, so close your eyes, and you stayed nice and straight. You do see a little bit of a sway, but that is a normal find. Now I'm going to do another coordination test. It's called the finger to nose test. So with your eyes open, I want you to touch your nose with your finger and then touch my finger. Sure. And do that. Perfect. So that's good coordination. Now I'm going to ask you to put your hands on your thighs, and I want you to put them up and down just like this. Okay. And then can you take the heel of one foot, and I want you to run it down the inside, all the way on the inside of your other leg. Perfect. And I would have you do that bilateral. A test I forgot to have you do is I want you to just take your fingers and then just touch your other fingers with it. And that's another coordination test. Perfect. Okay, now we're going to do some more neuro tests, and the first one is to check sensation. So I'm going to touch you again with this paper clip, and I want you to tell me which side is sharp and which side is dull. So if you could close your eyes. Okay.
Sharp, sharp, dull, sharp, dull, sharp.
I'm going to move down.
Sharp, dull, sharp, dull, sharp, 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 sharp.
And I would check it all the way through bilaterally on both sides. The next test is checking vibration. So what I'm going to have you do is close your eyes, and I'm going to use this tool, and when you feel the vibration, I want you to tell me, and then when it stops, I want you to tell me when it stops, okay? So if you could just close your eyes. Mm-hmm. First I'm going to do it on your finger, and then I'm going to do it on your toe. Okay.
Starts. Stop.
Now let's try your toe.
Start. Stop.
Perfect. Now I'm going to do another test for sensory, and what I'm going to do is I'm going to put a normal household object in your hand, and I'm going to see if you can identify it. So what I want you to do is close your eyes, and I'm going to put this in your hand. You can only use one hand. And can you tell me what that is?
A quarter.
Great, so that checks for your stereognosis, and that is intact. Next I'm going to do a test called graphesthesia, and it checks for fine sensation. And what I'm going to do is I'm going to write something on your palm facing towards you, and I want you to tell me what it is. So if you can close your eyes, and I'm going to do it facing you. Can you tell me?
3.
Perfect. So that also means that your graphesthesia is intact. Next I'm going to do what's called a 2-point discrimination test, and it's for very fine sensory. So what I'm going to have you do, Sam, is close your eyes, and I'm going to press this on this paper clip, and I want you to tell me if you feel 1 point or 2. Can you put your fingers out?
Sure.
Okay. So close your eyes.
Mm-hmm. 1. 1. 2.
Okay. So what I'm going to do is I'm going to measure this and see how far apart it is. About 4 millimeters. So I would say that your very fine sensory is intact. And I would also do this probably on your back, and on your back it would probably be a little bit further for you to feel the 2 points. Next thing, we're going to check your deep tendon reflexes. So I'm going to have you rest your arm for me. Can you flex it up?
Sure.
So when you flex it, I'm just going to feel for the tendon here. So I'm going to use the narrow part of my hammer, and I'm going to hit my fingers and see if we can get a reflex. Great. So I don't know if you could see it, but Sam's hand moved, so she had a +2 reflex in there. Next I'm going to do your tricep, so just relax. And I'm going to use the wider part. Great. And that was definitely a +2 on her tricep. Now if you could angle your hand and just rest it there for me. Next I'm going to try your brachioradial. Okay. And her fingers moved for that one, so you had +2 on all those reflexes. Next we're going to move down to your patella. So I'm just going to angle the mirror a little bit. The camera. Okay. And I'm just going to feel to the little groove. Perfect. And you have +2 right there on your knee. Next I'm going to move down to your Achilles reflex. So I'm going to have you dorsiflex your foot. And I'm going to come right behind here. Perfect. And so that was perfect. So you got all of them +2 reflexes. Next we're going to check the Babinski reflex. So what you would do is take the foot and you want to come up from the heel all the way over to the big toe, and the toes should curl down, which is a negative Babinski, and that is actually what you want. Okay? Okay, or maybe you're too ticklish, but if they fanned out, that would be a positive Babinski. But for adults, you want the toes to curl down, which is negative. The next thing I'm going to just check on Sam is for clonus. So what you want to do is flex the foot and then release, flex it again. Then I'm going to hold it. And now when I let it go, I just want to make sure I don't feel any beats of Sam's foot. And I don't, so she would have negative clonus.